Hi, everybody. Welcome to our first live joint camp class. This class is typically intended for those that are scheduled for a knee joint replacement or a hip joint replacement, or those seriously considering having a joint replacement. My name is Megan Goddard. I'm the orthopedic surgical nurse practitioner here at Kaweah Health. And today, our goal is to provide you with information to help you know what to expect when having a joint replacement surgery and what recovery will typically be like. Our plan is to go a little bit under an hour with this class, but we want to make all of your questions. So please send in your questions in the comment section. We'll be answering them as we go along. It will be me presenting today. Like I said, I'm Megan Goddard, the orthopedic nurse practitioner, and we have our physical therapist assistant, Art. I'm going to pass it on over to Art so he can introduce himself.
Hello everyone, my name is Art Castro. I'm a physical therapist assistant working here at Kaweah Delta Rehab Facility. I want to be going over some important information after surgery, which includes exercises, moving around, using proper equipment, and of course, additional therapy.
Thanks, Art. After
Thank
this
you.
video, after we're done today, the video will be posted on our joint camp website, on Kaweah Health's website, for easy access to look back and look over anything that you might want to relearn or revisit. It will also be posted on our social media accounts for reference. So again, thank you so much for joining us, and let's go ahead and get started. Like I said, Megan Goddard. I work with all the orthopedic surgeons that have privileges here at Kaweah Health. So the surgeon that you have that will be doing your surgery, I work right alongside them here at the hospital. So I'll probably be seeing you when you come in to visit us for your surgery. Joint camp is a class that we prescribe, just like we prescribe a walker or medication, for any patient that comes in that has a scheduled knee or hip joint replacement surgery. The purpose of the class is to discuss what to expect every step of the way. It's actually a pretty handy reference for the first year. We will be sending everyone home when they come into the hospital with this joint camper's reference book. It has all the information we covered today, plus a little more. So you'll be getting that when you come to the hospital at time of discharge. So that book is a communication tool. Like I said, handy reference for a year. I know that you get a lot of paperwork when you get scheduled for something. This is one that you kind of want to keep around and ready. And this is just a guide. Your doctor, me, your physical therapist, or your nurse at bedside may adjust things per patient for a plan of care. Planning for surgery, big deal. Before you come in for surgery, we want to make sure you have all your post-operative prescriptions filled and ready and waiting for you at home. So it's one less step to worry about at time of discharge. We also want you to have your walker ready and waiting at home. It's like a prescription, just like a medication. That will get prescribed to you at your visit with your surgeon. Make sure you have all those waiting at home for you. If you live alone, you're going to need to arrange for someone to assist you after surgery. This surgery is one that we want you up, we want you moving, we want you active as soon as possible, but you will need help. So allow your loved ones to help you during recovery for this surgery. Consider having assistance with caring for your pets. We like to prepare everyone going home to avoid falls. Every one of us has some tripping hazards along throughout our home. So we suggest going home, taking a peek around your corners, looking for those rugs that you may trip on every Wednesday, and say, oh, I trip on that rug every Wednesday. Roll that baby up, put it in the garage for when you're fully recovered from surgery. Anything that may cause you to bump or bruise yourself should also get put away or prepare to avoid that after surgery. You'll also need to plan for a ride home, no driving yourself home from surgery. And so, like I said, big deal is bringing in someone to help you after this surgery. This is not a recover by yourself surgery. This is ask for help because you're going to need it as you move along and continue to get better day by day. On the day of surgery, you will have been given a special type of soap called chlorhexidine. We're going to ask you to wash your body with that chlorhexidine soap the morning of your surgery. It helps get rid of the normal flora bacteria all over your body in preparation for surgery to avoid post-operative infections. We're also going to ask that you brush your teeth extra special good that morning because we use a tube during surgery to help with your airway under sedation and we don't want any extra bacteria sitting in your oral airway when we use anesthesia. We will be providing you with a carbohydrate drink that you're going to drink before your hospital, that you drink at home before you come to your appointment. You're going to drink it prior to leaving the house. So if you're scheduled for surgery, you need to be at the hospital at 7 a.m., you drink that drink right before you hop in the car and head on your way to the hospital. This is the only thing you will be allowed to take by mouth before surgery. You will be nothing to eat or drink starting at midnight the night before your surgery until you have this carbohydrate drink before you leave to the hospital. We do encourage that you leave all your valuables at home. You'll need your ID, your medication list, and in this booklet it covers special things to bring that are important, like a good steady pair of shoes, because you will be up and walking right after surgery. You want to start putting it in your brain that you're going to get discharged probably the same day as surgery. I know that seems crazy with this type of surgery that you're going to be having. You're getting a brand new shiny joint, but all research shows that the sooner you are up and walking after a joint replacement surgery, the better your long-term outcome is. And we want you by 3 months walking and shopping on that 2-hour Sunday Costco trip. So plan for discharge the same day because you're going to be up and you're going to be moving. There are, of course, exceptions to the rule, and we make that per patient, per experience. But early movement, early physical therapy, and pain control are our priority. Getting you comfortable and being able to continue your recovery and healing in the comfort of your own home is vital to our long-term goals. You will be ambulating the day of surgery. I know I've said that a couple times already, but I really like to bring that point home. We want you up. We want you moving. Your first time getting out of bed will, of course, be with a nurse or a physical therapist. You are not going to be alone. And you'll have the support of that front wheel walker that you'll have been prescribed. They have them at the hospital to utilize after surgery. Pain is unavoidable with any type of surgery, but especially with the joint replacement surgery. When we talk about pain after joint replacement, we talk about the word tolerable. Typically, tolerable pain after joint replacement lies within that pain range, 0 to 10. We like to say between 5 and 8. Tolerable pain means you know it's going to hurt. You know it's unavoidable for it to not hurt, but you have to get up and move because that's what's best for our long-term outcomes. So you should not be so uncomfortable in pain that you cannot walk or that you cannot sleep. Pain control includes taking pain medication before pain is out of control. Medication typically needs about 30 minutes to start working. If you start to feel like your pain is verging on that out of control level, let your nurse know. We need to make adjustments to your pain medication plan. We can do that. We want to make sure that you're safe and able to walk without excruciating pain, while also knowing that, like we said, pain is unavoidable and we're shooting for that tolerable level. We are here to help you, and we encourage you to do as much for yourself as you can. Getting up to the chair for meals while you're here at the hospital and when you're at home, and walking the same day of surgery is part of the plan. We also talk about doing as much for yourself as possible, but not pushing too hard. You know your body, you know your limits, so work with us in helping you get to the best possible outcome. Same day surgery, after surgery, you're going to continue with your prescribed medications that the surgeon gives you. It probably will include stool softeners because our pain medication can cause slower gut motility, which can cause constipation. And no one needs a little bit of constipation after any type of surgery. And then, of course, everyone will be on a blood thinner for at least 30 days after a joint replacement surgery. Some of you that are having joint replacement surgeries will have already been on blood thinners, and your doctor will have told you to stop taking those before surgery in preparation. After surgery, you'll start right back up on those. Everyone will have a follow-up appointment with their surgeon about 2 weeks after surgery. And if that hasn't been made, we'll make sure that it gets made before you leave or right when you get home. If you are a diabetic patient, you need to be monitoring your blood sugar closely. Infections can cause an increase in blood sugar, and that's a problem no one wants to encounter. So diabetic medication will be started soon after surgery as well, and we'll be monitoring blood sugar, as you should as well when you're at home. After discharge, surgical wound care is vital, so important. You want to keep your wound clean and dry. Avoid touching at it, scratching at it, those, very human tendencies. Can we go back one slide? Thank you. Watching for signs and symptoms of infection, redness. And when we talk about redness, we mean a bright, hot red. Your wound after surgery will, of course, be a little red because we just caused some inflammation, but a bright, hot red is what we're trying to avoid. Drainage, increased pain and swelling, or even a fever. You will begin to feel sick if your wound gets infected, and this can typically happen about 7 to 10 days post-operatively. If these symptoms do occur, we strongly encourage you to call the surgeon for any of the symptoms. Your surgeon knows how to treat these things. If it were to happen, they know how to handle it over the phone. That's the phone call they want. Post-op anemia is common. Post-op anemia is when your blood level drops because of blood loss during surgery, which is typical for this type of surgery, though usually minimal. It's something we do monitor through vital signs and blood work. Iron-rich foods and iron supplements may be used to help prevent or treat post-op anemia. A diet that includes plenty of protein, vitamin C, and zinc can help with wound healing and post-op anemia. If you are prone to anemia, your doctor has probably already put you on supplements or encouraged you to have a diet rich in iron. But like I said, our nurses and our surgeons are great at monitoring for symptoms of these things and will be taken care of. In some scenarios, a blood transfusion is required, but those scenarios are rare. Frequently asked questions. We'll cover all of these. And like I said, if there are any lingering questions, go ahead and send those into the chat and we can address them as we're chatting. Will I have a catheter placed into my bladder? During surgery with sedation, you cannot control your bladder. So almost every patient will have a Foley catheter. This Foley catheter is placed while you're under sedation and is typically removed under 12 hours after surgery. We want it removed quickly and have you up and using the restroom as soon as possible. Will I be at risk for blood clots? Blood clots happen in patients when we are sedentary. Blood pools during surgery, and that can cause clotting. We do a lot of treatment to prevent these blood clots. After surgery, you may have compression stockings or compression boots that help with continued blood flow. And that's also another reason we put all of our post-operative joint patients on blood thinners. Early ambulation is a big way to prevent blood clots. So another reason we want you up and want you moving. Postoperative anemia, like we covered earlier, is a loss of blood because of surgery. It is expected to lose blood during surgery, though it is a minimal amount. The surgeon monitors how much blood is lost during surgery, and if we need, we can treat it with iron supplements, iron-rich diet, and if in some scenarios, we will use a blood transfusion. How soon can I shower after surgery? All of our surgeons use a really neat surgical dressing called Praneo. It's a clear mesh dressing that goes right over your incision site, and it's waterproof. You're allowed to shower same day as surgery. You can wash your body with soap and water. You just can't scrub it like you're scrubbing away at a dirty pot, and we don't want you soaking in a hot tub, pool, or bath until that is removed or until cleared by your surgeon. But that Praneo dressing will stay in place until about your 2-week post-op appointment with your surgeon. It is human tendency to want to pick at the edges because sometimes the edges will roll up. All you want to do is take a little pair of scissors or even nail clippers and clip off the edges. It's a pretty neat dressing. We really like using it. How much can I do for myself? This is a really common question that a lot of people ask because some people want to get up, they want to get back to Costco, they want to get moving with that bright new shiny joint because their pain is so much better than before surgery. We like to say every day is a little more. I don't want anyone pushing themselves too hard after surgery because then you could lose a couple days. We want to do a step tier system. One day we're walking from the couch to the bed to the bathroom. The next day we might stand in the kitchen for 5 to 10 minutes making a sandwich. Every day is a little more. Soon we're out walking to the mailbox. But like I said, we're not running to Costco post-op day 2 and beating those Sunday crowds. We want to go day by day, a little more every day. Asking for help is imperative after surgery. You want to make sure that you're taking good care of yourself so that every day is better and we don't lose anything or we put ourselves in a situation where we are at risk for falls, at risk for infection, or at risk for too much pain. How do I care for my incision at home? Like we talked about, that perneo dressing stays in place. You just want to monitor for those signs and symptoms of infection. A red hot wound, a funky odor, strange drainage, yellowy, beige in color, or a pain that is out of proportion to what we expected, right? Something that is new. Your pain was controlled on the oral medication the doctor sent you home on, and then all of a sudden something changed. Any one of these symptoms warrants a call to your surgeon. First call should be to the surgeon. Can I use ice packs? Your new best friend is the ice pack. 30 to 40 minutes on at a time and about an hour off. Ice helps with inflammation, which is a big cause of what's causing this pain after surgery. Utilize those ice packs. The nurses after surgery will provide you with ice packs. You can use homemade ice packs. There are even gel ice packs that can wrap right around your hip or your knee. Those are available for purchase at any store, Walmart, Target, Amazon. And then some doctors use ice machines to help at home, and they'll have prescribed that if ordered at your pre-surgical appointment. If you have any questions, concerns, or anything, please do not hesitate to ask a member of the care team prior to discharge. That's our job. We want to help answer these questions. We want to make sure they're answered in real time, and so that nothing is lingering when you get home. Make a list. I really do encourage our patients to make a list after this class of any questions that you feel were unanswered or maybe sitting in your head a little too long. Bring that list with you. If they haven't been answered at the time of discharge through the hospital stay, bring it on out. Ask your nurse. We'll make sure it gets taken care of and that you get the answers you need. I think we have a couple more slides to cover pre-op visits. Before surgery, you'll be heading to CATS, right here, Kaweah Health Admissions and Testing Services. It's on Court and Walnut, or in between, it's on Court between Walnut and Tulare. This is where you'll go to get pre-registered for surgery. It's where you'll get that special soap you'll wash your body with, where you get your carbohydrate drink, and where the surgery schedulers put you in the system so the hospital knows that you exist. Your surgeon, each surgeon schedules their patients at different times for this. So don't worry if your surgery is scheduled for Monday, you'll probably go on a Friday to your CATS appointment. They will also provide you with this super special parking permit that allows you to park right outside of our surgery center the day of surgery. Make sure you bring that and leave it in your dashboard so you won't have far to walk. When you arrive at our surgery center, you will walk along the AstroTurf grass. There's signs all over the place that'll lead you right in the right direction. Surgery patient parking only, VIP access I like to call it. You'll park in one of these spots and you'll follow these signs up on this PowerPoint, and there's a doorbell that you'll check in. They'll ask for what surgery you're having. They'll get you checked in, and that's when all the questions begin. What surgery are you having? Who's your surgeon? What medications are you on? They check your insurance card. They check your ID. You'll then get taken into our ACS, which is our, or ASC, sorry, surgery center, where more questions. The nurses will ask about your medical history, about your medication list. They will cover all the basics on what surgery you're having. They even ask questions like, what side are we operating on? We ask these questions not because we don't already have the answers or we don't communicate with each other, but every step of the way, we're making sure that we're doing the exact right treatment for the exact right patient, and that everyone on your care team is on the same page for your care plan. So it can feel a little tedious, but it's done with the best intent to keep you safe. You'll then go into the OR with your surgeon after he signatures the limb he'll be operating on, right or left. After surgery, you'll go to our post-op area where they'll recover you. Most likely you will end up on Broderick Pavilion, where our elective joint surgeries go, or 4 South, our orthopedic floor, depending on availability and depending on room availability. This is Broderick Pavilion. It's gorgeous. Both floors are more than equipped to take care of our post-op surgical patients. These nurses see orthopedic patients day in and day out. They work with our orthopedic surgeons on a daily basis. The care you receive is amazing. And if you have any questions, everyone has my extension and I can come up and help with anything lingering. I think that's the end of my portion, so I'm going to pass it on over to Art unless there's any lingering questions. Oh, I think I have a question. Hold on one second. Okay. Yeah, we'll pass it on over to you, Art.
All right, thanks, Megan, for that wonderful information. So, of course, everyone, please feel free to send those questions over. In my portion is more of a show and tell because it's very important. First off, after you get your new hip, your new knee, now what? That's the biggest question. Well, I have some important answers for that. So the most important thing you can do is move. Along with moving is exercises. Please refer to your booklet for specific exercises, but be very aware of certain, they call them precautions. Precautions meaning what movements you cannot do. Okay? So please refer to your booklet and for the exercises and your surgeon for better clarification on specific movements. Okay? With exercises, how many times can you do them? Well, my recommendation, as a physical therapist assistant, we recommend the more you move, the more you can exercise within a healthy range that's tolerable pain, the better for you. You can do 1 to 3 sets, 10 to 20 repetitions, preferably 3 times a day. Again, the more times you are able to move and the more you're able to do your exercises, the better, stronger, and circulation you can get for and prepare for you to go back to where you need to go. Okay. So now let's go back to the equipment. Okay. Along with exercises and mobility, what can you do if you cannot move? Well, I have a few items prepared to show you. Couple of things here. Long-handled sponge. This is great for cleaning your feet. If you can't reach them, you can't bend over because you may be a little sore especially after a hip surgery or knee replacement. You have a handy reacher, okay, a little grabber. This is perfect to go and grab something you cannot reach. I highly recommend everyone to grab and have one of these in your household. Now going on into putting socks in your shoes. Right here, we have a sock aid. Okay, I'm going to do a quick demonstration on how to put a sock on your sock aid because it's, of course, to put on some shoes and socks, you're going to need to bend over. Well, if you can't bend over because of pain, the best thing you can do is to use a sock aid. So we're just going to grab the sock, insert it as so, okay? And I'm going to show you, this is my leg, okay? So what you're going to do is put this over. You don't have to bend over. There's some nice long ropes, long handles for you to just toss it over. Put your foot inside. Okay? And then now you just pull on the ropes and voila. You have your sock on without any additional pain. So now you want to put on your shoes. Well, obviously you can't bend over, maybe because of pain, but we have a long-handled shoehorn here that's going to be very important. All you're going to do is stick this right between the end of your shoe and your heel, and it can easily, your shoe can easily, or your foot can easily pop into your shoe. Next item was a dressing stick. Okay, we have a little hook in one end. And then we have some nice little angles on this other end where you can use to move around your pants, your socks, or anything else that you can to feel better for you to use. Okay. Now the next portion we're going to do is the bathroom setting. Okay. So let's go over our first item here. This is called a bedside commode. This is called a bedside commode. If you cannot walk long distances, this is great. Okay, as you can tell, there's a little bucket. Okay, This prevents you from walking about 80, 50 feet, or if your bathroom is long distance. Okay. Let's just say you want to use your restroom, but your toilet is very tiny. We have something that's called a raised toilet seat right here. This just simply can go on top of your basin, and you're able to sit down nice and comfortable without any additional pain. This next item here is a shower chair. If you have a tub or a shower stall and you need to sit down because of pain, it's overwhelming, this is very safe to use. It has some rubber footing here. You could simply put it in your shower or your tub, and you can sit down safely. Now, what if you have something that your chair cannot fit? Well, I have something called a shower tub transfer bench. That's right over here. Okay, as you can tell, it's very long on one side, and the middle portion is a seat. So half of it can go into the tub, and half of it can stick out. So this way you can safely sit on one end, and then slide to the middle, and you can take your shower as needed. Okay. Last but not least, and I forgot to mention in the very beginning, well, you can't go anywhere without using a front wheel walker. After you leave your surgery, you're going to be assigned one of these if you're unable to walk without a device. Very easy to use. All you're going to do is just flip it outwards as so. Okay? And then you're going to use this to assist you for ambulating. Okay? Very, very neat device to help you with less pain. And of course, there's buttons here to push down. It can easily fold. Okay. Now that all the equipment is done, and I briefly explained the exercises, and if you still need additional help, there are additional services with physical therapy and occupational therapy that's provided for you through home health and through outpatient therapy. However, if by any chance you're unable to clear the hospital, well, you can also come to the Kaweah Delta Rehab Facility, and you may see me there. All right. I hope I answered everyone's questions. Thank you very much.
Thanks, Art. That was great. I like the live thing. We're
Thanks,
really
man.
moving and shaking things. It's the hospital doing hip surgeries right now. So for a while at the beginning of COVID, almost all elective surgeries were canceled unless it was an urgent and emergent basis. Elective hip surgeries again. We are limited to a certain number of admissions per day, and the surgeons have all been aware of that. But we are now scheduling total hip replacement surgeries here at Kaweah Health. And we're very happy about it and excited to have our patients back. Funky forum to be having an education course, but we want to make sure that we're answering any lingering, any question is a good question in medicine. We like to take care of our patients and make sure everyone feels comfortable about what they're choosing to do. And joint replacement surgeries are not as scary as what they were years ago. People come in, we get them home same day. We've been doing a great job. Our post-op surgical team, our nurses are phenomenal. Our physical therapists are phenomenal. Everyone's been working really hard together to keep our patients safe, get them into the hospital, get them up, mobilizing, and get them home and out of the hospital so they can recover safely and comfortably at home. We have another question. Are our spouses able to be with us before surgery? So right now, yes, you are allowed one person to sit with you in the pre-op area. They do have to have proof that they either have their vaccine, including their booster, or a negative COVID test within the last 48 hours. And it cannot be an at-home test. It has to be a test that was done at a facility. I know that our facility on Court Street, our urgent care, offers that type of testing, an ID Now rapid COVID test, and they allow you to get swabbed and bring in your negative test so you can be with your family member before surgery. Any other questions? I think I mean, I can talk forever, everybody. Don't give me the platform. Oh, I think we have one more question coming in. Hold on one second. Is there an overnight stay or is it same day? That is a great question. So we, of course, want everyone to go home as soon as possible. But typically, because of hours of physical therapy availability, even though they're staying later than before COVID, because we're changing our hours to make sure our patients are getting the exact care they need, if your surgery is after noon, you will probably stay overnight in the hospital and work with physical therapy early the next morning. It doesn't mean you won't be getting out of bed that night. The nurses will help you get up for dinner. They'll help you get to the bedside commode or the toilet to use the restroom. And then the next morning will be your official physical therapy work. And then we'll probably get you home the next afternoon or early evening. Correct. So if the spouse has a vaccination card and is boosted, just the card and no test is needed. That is correct. You have to have proof of vaccination with booster or proof of a negative COVID test within the last 48 hours. These things are, of course, changing on a daily basis. COVID precautions are a fluid thing. I think after 2 years, we're all very well aware that so much happens and so much changes. On our website, we do have updated visitor regulations and policies on their Kaweah Health website. So if any information I'm giving today doesn't match that, go with the Kaweah Health website. So before we end today, how long is a total knee replacement surgery? Again, everything we talk about is varied patient to patient, but a typical surgery can last from an hour to 2 hours. Our surgeons do this surgery, multiple of them in one day, so they're moving pretty quick in a safe and steady manner. A basic knee or hip is about an hour and a half, 2 hours, but can be as quick as 1 hour. We do offer the new robot, Rosa, that Dr. Kim, Dr. Kreiner, and Dr. Duncan, and that can change the timing as well. So this is a great question right before your surgeon, to ask your surgeon at your last surgical visit. How long do you expect to be in the OR? Honestly, a big chunk of time is the pre-op and the post-op recovery. But our surgeons do a really great job of calling family right after they're done and right after the surgery is done and the patient is all closed up and heading on their way to recovery. The surgeon will call and update family on how everything went. Oh, we have a question about the carbohydrate drink, which is a great question. This is a brand new thing we're doing for joint replacement surgeries. It's part of our program that will be rolling out next month called ERAS, Enhanced Recovery After Surgery. A lot of research has shown that this do not eat or drink anything up until surgery isn't 100% necessary across the board, but that this carbohydrate drink helps with post-operative recovery. It helps with preventing post-operative hypoglycemia or low blood sugar. It helps with hydration. It helps with the essential carb loading, electrolytes. I don't want to use the term Gatorade, but it's kind of like a Gatorade drink where it keeps your body because you haven't eaten or drank in so long, it keeps your body in a healthy state, which is almost protective during surgery instead of a dehydrated, no electrolyte state like what we were doing. So that will be starting in March. and it's going to be lemon, lime, or strawberry, one of those fun Gatorade-like flavors. And you drink it before you leave your house, so it'll be in your system about typically 2 hours before when you actually roll into the day, not overnight. Right now, like I said, we have strict visiting hours because of the COVID-19 precautions. And to visit the patient in the hospital, the same applies for the vaccination card with booster proof or a negative COVID test within 48 hours from a facility like an ID Now rapid testing facility, not a home test. No one can stay overnight, but during visiting hours, you are more than welcome to stay in the patient's room. While in the patient's room, patient visitors do need to wear a mask. Eating and drinking is not allowed right now because of COVID precautions while the visitor is in the room. Like I said, I know these precautions seem strict, and they are for a reason, to keep our patients who are post-operative safe from COVID and to keep our staff safe from COVID so they can keep working at the bedside with your family members and keep our patients safe. But they are changing on a daily basis. Referencing our website for the most up-to-date precautions and visiting our regulations is appropriate. I think we have another question coming in. Is the scheduling backed up? That's a tricky question, but let me see if I can answer it in the best way possible. Because we had to stop so many surgeries early on in the COVID-19 pandemic, surgery scheduling is, I don't like the term backed up, but more thrown off. We had to adjust to who could come into the hospital because we weren't allowed admissions, and which surgeries could get into the hospital and home the same day. This is a great question to follow up with your surgeon. They are working overtime to see patients, multiple patients, 50 to 60 in a day, and get them scheduled in a timely manner. And that scheduling is changing every day as well, because you have to get COVID tested, and some people just aren't willing to do surgery right now because of COVID restrictions. Some people end up getting a positive test before surgery. So these funky delays that we've never experienced before keep happening, but everyone at Kaweah Health and us, Kaweah Health and the surgeons are working on a daily basis to make sure that we're getting in as many patients in a safe way to get these surgeries done that are vital to patients and their quality of life. I think I have another questions here sitting. These are great questions and 100% appropriate. I really appreciate everyone being involved. I love answering stuff like this because we have all these questions lingering, and usually sometimes we're hesitant to ask or we're unsure of who to ask. This is the exact platform. And the questions that you guys are asking are going to get carried onto our website and our social media platform. So you're probably helping other people who have the same questions as you get them answered. So thank you guys so much. While we're waiting, for any other, what to wear at admission, same clothes to go home. You do not have to do that if you do not want to. Wear something comfy because you're going to change out of it the minute you get into our pre-operative area. And if you want family to bring in a comfy set of clothing to wear home, that's great. With the total joint surgery, you want comfy clothes. We're not asking for stilettos or skinny jeans. Comfy clothes to wear home, baggy clothes, sweats, some mobilize in, and that you feel comfortable enough to walk after surgery or comfortable to get up and into the car to head home. Some people even bring in a robe to wear while they're here because they know they're going to be sitting in their chair if they stay overnight. So if your surgery's in the afternoon, you may want to bring an extra change of clothes. And if you don't want to pack all that, you don't have to. You can definitely wear the same thing home that you wore in. Do we need the vaccine and booster to have surgery? Janet, that is a great question. I do not believe that you do. You just have to have a negative COVID test. So all of our patients get tested for COVID at their pre-operative appointment. The negative test is the same as for our visitors. They need to have a negative test. It's either 48 or 72 hours prior to surgery. I will double check while we're all sitting here. But there is, not that I've heard, You have to be vaccinated or boosted. You just need to have the negative test. Great question. And I will find out that information and make sure that we have that for you. Do we need to register our CPAP machines when, if spending the night? You should let your surgeon know that you will be utilizing your CPAP while in-house. What is typically easier to do sometimes is let our respiratory therapy know, and we can use your same settings. But when you come in for surgery, have your CPAP, we can get one of our team to get it registered so it can be utilized. Vital thing to bring in. It's as important as your diabetic and hypertension medication. So yes, please let us know. Let your surgeon know so we can start preparing before you even come into the hospital. You guys, these are wonderful questions. I love the engagement, and I love being able to help out with this stuff. This is really important to both Art and I and our surgeons that these questions get answered. Another question came in. What's the best advice for patients worried or nervous about surgery? I think both me and Art can handle this. I think a lot of people are hesitant because of pain and then recovery. The benefit of having surgery this day and age is that we have medications that work very well for pain control, and we have a group of surgeons that are well versed in all different types of body habitus, arthritis, procedure. So each patient gets the exact care they need for their type of surgery. Joint replacement isn't a blanket, pop it in, pop it out, next one. It's not a, what's the word, Art? Service line. Every patient gets treated as an individual, which is really important to not only the staff at Kaweah Health, but to our surgeons, because they want your outcome to be the best for your quality of life. Nervous for surgery is typical, almost unavoidable, but talking to your surgeon, asking these questions, making the list of questions and making sure all your concerns are addressed and advocating for yourself in the moment, that's the best way to get through that nervous feeling and that fear of surgery. Because our surgeons want you to have quality of life that matches what you are searching for. Our nurses want you to feel comfortable after surgery. Our physical therapists want you up and feeling healthy and invigorated to move. Our whole team our goal is to aid in your health. So if there's any lingering fear or questions, help us address that so we can get you in and get you the treatment that you need. Art, do you have anything to add to that?
Actually, I do. I'm glad you asked. The most important thing for a speedy recovery is to keep moving and do your daily routines and start an exercise regime program before your surgery. Believe it or not, having that excessive and ready to build muscle prepared for the new incoming joint will actually speed up the recovery process. And you can, instead of losing strength, which you will a little bit in the beginning, but if you're stronger enough before surgery and after surgery, you don't lose that much strength because you had that build-up tolerance already implemented into your daily routine, and recovery time will actually be more quicker for you.
My right knee replaced 9 years ago at Kaweah Health and had an excellent experience. Whole team was exceptional. Woo! We love that information. Yeah, same, Art, just clapping away. Thank you so much for that feedback. We love hearing good feedback like that because we really do strive for these phenomenal outcomes. Our surgeons take pride in a solid outcome because their ultimate goal is to have you living your best life, pain-free, up and active. I think here in the Central Valley, in Visalia specifically at Kaweah Health, we are really lucky that the group of surgeons that operate here have the best intention at heart. I work with them on a daily basis, and I'm really proud to say that I work with this group of surgeons because they want their patient population to feel better. And that's the only goal I've really heard from them on a daily basis is patient care, patient outcome. Art, what other best advice do you have for our patients post-operatively?
sound like a broken record at this point, but you got to move. Move within your mobility range, meaning if you have strict precautions or movements you cannot do per your surgeon, then do not even attempt those. You got to wait to be cleared by your surgeon, most importantly. But then within those limits, move around. Do your exercises. It's very crucial, very important. I cannot highly address and support and give the encouragement of move. The more you move, the better of a greater feeling you have. It promotes strength, circulation, range of motion, and it could go on. And the quicker you're able to do all that, the quicker you can go home and be your normal self again.
Exactly. Tori sent in a great question. Is there different anesthesia for hip replacement? Is there options, or is it the same for everyone? Phenomenal question. Typically for a joint replacement surgery, there are two options: general anesthesia or a spinal anesthesia. General anesthesia is the treatment with certain medications that put you into a deep sleep so you do not feel any pain during surgery. When you receive these medications, you will not be aware of what is happening around you. You'll be monitored closely while you're asleep. Blood pressure, pulse, breathing, everything's monitored by the anesthesiologist or the CRNA. You will not move, feel pain, or have any memories of the procedure because of the medication you're under. That's the one where they're utilizing the tube down your throat because you're asleep and we're monitoring your airway. The spinal anesthesia is a treatment where the doctor injects medication into the fluids surrounding your spinal cord in the lower part of your back. The medication begins to take effect right away and will not wear off for several hours, even after surgery. But still, your pulse, blood pressure, oxygen levels are all monitored during the procedure. After the procedure, we'll have a bandage where the needle was inserted. Those are options per patient. Again, nothing is blanket. The anesthesiology team will take into account your medical history, the medications you typically take, your surgical history, and they will make a plan based on your medical history alone. And they'll even discuss these options with you so you can have input in your surgical plan of care. That's really important to us that, like I said, each patient their plan of care is individual to them. All right, guys, this was wonderful. Thank you again for the solid engagement, for all the questions. Not only did you get your questions answered, but we're going to be answering people's questions in the future, whoever watches this video on our social media platform, or if this, and when this goes on our Joint Camp website. I look forward to seeing you guys when you're here at the hospital. Like I said, if you have any questions or anything, let us know. Any lingering questions that didn't get answered today, or if there's something that you think of later, send it in and they can get sent to me, and I can either email you or find a way to get a hold of you, and we can get those questions answered. Art?
Yeah, thank you everyone for this great opportunity, and as always, keep moving.
Thank you, Art. And thank you everybody so much for joining us. This class is typically held every Wednesday at 3:30 at the Lifestyle Center. If you are a friend or want to attend again, or you know anyone that needs this information, this will be on our website. It will be on our socials, and it will be every Wednesday at 3:30, masks included. And stay safe, everybody. Thank you so much.